What if your body is sending you postcards from the edge of a health crisis, but you've been mistaking them for junk mail? We're going to begin today not with a list, but with a story. A story about a woman named Brenda.
Brenda defined herself by her garden. It wasn't just a hobby. It was her sanctuary, her legacy. Each tomato vine was a testament to her patience. Each rose a splash of color she'd personally negotiated with the earth. Her grandchildren knew Grandma's house was the place of sun-warmed strawberries and the sweet smell of phlox. But lately, a subtle thief had begun to visit her sanctuary. The primary health struggle wasn't a sudden event. It was a quiet, creeping shadow of heart failure, stealing the very things that made her Brenda. It started with little things. A frustrating shortness of breath when she bent to tie her shoes before heading out to the garden. She'd blamed it on the extra 5 pounds from the holidays. Then came the walks with Rusty, her beagle. The gentle slope in the park, a path they'd walked for years, suddenly felt like climbing a mountain. She found herself stopping, pretending to admire a cloud, while her heart hammered against her ribs, desperate for air. The joy of the walk was being replaced by a quiet dread of the effort. This wasn't just physical. It was an erosion of her identity. Brenda had always been the strong one, the matriarch who hosted every family dinner, the one who could lift a squirming grandchild with ease. Now, carrying a load of laundry up the stairs left her winded and dizzy. She'd sit on the edge of the bed, her head spinning, waiting for the world to settle. The feeling of being frail, of being a spectator in her own life, was a constant, humiliating companion. The nights became the worst. She'd started with 1 extra pillow, telling herself it was just more comfortable. Soon it was 2, then 3, until she was practically sleeping, sitting up. But the true terror arrived one night, a few hours after she'd drifted off. She awoke with a jolt, a primal panic seizing her. She couldn't breathe. It felt as if her lungs were filled with water, a silent, terrifying drowning. She scrambled out of bed, gasping, her heart racing, stumbling to the open window and gulping at the cool night air. And in that quiet, lonely moment, a single thought echoed in the chambers of her heart, a fear she had never dared to voice. My body is becoming a house I can no longer live in. Despair settled in 4 days. Then, one morning, looking out her kitchen window, she saw it. A single, perfect rose on her favorite bush was beginning to wilt, its head bowed from a lack of water. And in that moment, something shifted. She thought, I will not wilt. Not yet. It wasn't a roar of defiance, but a quiet, firm whisper, a decision. Brenda realized she had been treating these symptoms like individual weeds to be ignored, instead of seeing them as signs that the entire garden of her health needed urgent, loving attention. Weeks later, after a doctor's visit she should have made months earlier, after starting new medication and making simple but profound changes, Brenda was back in her garden. She moved a little slower, a little more deliberately, but she was there. She could bend down to pull a weed without that frightening breathlessness. She could sleep with just 2 pillows. She could walk Rusty to the end of the block and back, enjoying the sunshine on her face, instead of fighting the fire in her lungs. She wasn't reclaiming mountains. She was reclaiming moments. And she discovered that a life is not measured in mountains climbed, but in precious, simple moments lived.
Brenda's story is a quiet one, but it's a story lived by millions of Americans. You may even recognize parts of your own story in hers. You've been told that feeling tired, getting a little breathless, or waking up at night is just a normal part of getting older. But what if that's not the whole truth? What if those are just the first soft whispers of a much more serious conversation your heart is trying to have with you? Over the next few minutes, we're going to uncover 13 of these subtle signals. We'll move past the common knowledge and explore the signs that are most often overlooked. We'll talk about a misleading gut feeling that has nothing to do with digestion, and the cough that only comes out in the dark. And you absolutely must stay with me until the end, because the final signal we'll reveal, our vital truth number 1, is a little-known symptom so specific and so telling, it can happen in the 30 seconds it takes to tie your shoes. It's a game-changing piece of knowledge. Before we dive in, please know that all the information we share is for educational purposes. Always consult with your personal healthcare provider before making any health decisions. Our goal is to empower you with knowledge. If you're ready, let's begin this journey together. Warning number 13, a common deception. Let's start with the one most easily brushed aside. Shortness of breath during activities that used to be a breeze. This isn't about being winded after a strenuous workout. We're talking about gasping for air after climbing a single flight of stairs or walking from your car to the front door. The problem is our brains are brilliant at making excuses. We tell ourselves, I'm just out of shape, or I guess this is what 70 feels like. But that progressive decline isn't always normal aging. It's often one of the earliest and most common signs of heart failure. To understand this, let's use an analogy. Imagine your heart is the central water pump for a large, intricate fountain. A healthy heart pumps with enough force to send water easily to the highest tiers. Therefore, the entire fountain is vibrant and active. But when the pump weakens, as in heart failure, it can't push the water with the same force. The lower levels are fine, but the highest tiers barely get a trickle. In your body, your muscles are those higher tiers. During activity, they demand more oxygen-rich blood, but the weakened heart pump can't meet the demand. As a result, your lungs have to work overtime, spinning faster and faster, trying to force more oxygen into the system. This frantic effort is what you experience as breathlessness. So if you notice that routine tasks now require you to stop and catch your breath, don't just dismiss it. It's not a sign of weakness. It's a critical signal from your body's central pump. Warning number 12. The exhaustion that won't quit. Next is a feeling so pervasive it can feel like the new normal, overwhelming fatigue. This is not the kind of tiredness that a good night's sleep or a relaxing weekend can fix. This is a bone-deep exhaustion that makes even simple daily tasks feel like monumental efforts. When your heart struggles, your body makes a life-saving executive decision. It initiates a process of triage, diverting blood away from less essential areas, like your limb muscles, and prioritizing flow to the most vital organs, your brain and the heart itself. It's a brilliant survival mechanism. However, the consequence of this is that your arms and legs are constantly running on a low-fuel warning light. They don't get the oxygen they need to function properly, leading to that profound sense of fatigue and weakness. A short walk that once energized you might now require a long rest. Let's think of it like the electrical grid in your house during a power shortage. To keep the essentials running, like the refrigerator and the furnace, the power company reduces voltage to other parts of the house. Therefore, the lights in the living room might dim, and appliances in the garage might not work at all. That's precisely what your body does. It dims the power to your muscles to keep the life support organs running. This isn't laziness, it's a biological state of emergency. This is your body telling you the power supply is compromised. Warning number 11, the telltale swelling. Now for a sign you can often see and feel, swelling in your ankles, feet or legs, medically known as peripheral edema. This isn't the minor puffiness from a long car ride. This is persistent swelling that gets worse as the day goes on. Here's the conflict. It's easy to blame gravity or salt intake, but in the context of heart failure, it's a direct result of a circulatory traffic jam. When the heart can't pump blood forward effectively, blood returning from the legs can't get back into the heart efficiently. It backs up in the veins. At the same time, your kidneys sense the reduced blood flow and think the body is dehydrated. So they go into conservation mode, holding on to salt and water. This extra fluid has to go somewhere. Imagine your circulatory system is a network of highways, and your heart is the central interchange. If there's a major slowdown at the interchange, traffic will back up for miles. That's what's happening in your veins. Consequently, the excess fluid, like frustrated drivers, starts exiting the highway, your blood vessels, and pooling in the surrounding neighborhoods, your tissues, causing that visible swelling. You might notice your socks leaving deep lines on your ankles, or your shoes feeling tight by the evening. That's not just an inconvenience, it's a sign of a major traffic jam at the center of your circulatory system. Warning number 10, the deceptive scale. This next signal is one of the most measurable and alarming: rapid weight gain. We're not talking about a few pounds over a month. We mean gaining 2 to 3 pounds in a single day, or 5 or more pounds in a week. This is a sign that often appears before the visible swelling or significant breathlessness, acting as a crucial early warning. The weight isn't fat, it's water. As your heart's pumping function declines, it triggers hormonal changes that scream at your kidneys to hold on to every last drop of salt and water. The analogy here is simple but powerful. Think of your body as a bathtub. Normally the faucet fluid intake and the drain, kidney function, are perfectly balanced, keeping the water level stable. But with heart failure, it's as if someone has partially closed the drain. Even with a normal amount of water coming in from the faucet, the water level begins to rise and rise and rise. That's the fluid retention you see on the scale. For this reason, many doctors insist their heart failure patients weigh themselves every single morning. The scale doesn't lie, and it can be the first to tell you that the drain is clogged and the tub is about to overflow. Warning number 9, an unsettling rhythm. Let's talk about the feeling of your heart itself, palpitations or an irregular pulse. This can feel like a fluttering, a pounding, a racing, or even a skipped beat. It's unsettling because it's a direct reminder that the engine of your body isn't running smoothly. A weakened heart muscle is often an irritable one. As it strains to pump blood, the heart's electrical system can go haywire, leading to irregular rhythms like atrial fibrillation. The relationship is a vicious cycle. Heart failure can cause arrhythmias, and arrhythmias can worsen heart failure. Think of your heart's rhythm as a skilled drummer, keeping a steady beat for a band. This steady beat allows all the musicians to play in harmony. However, when the drummer is tired and struggling, the beat might suddenly speed up, slow down, or miss a beat entirely. As a result, the entire band is thrown into chaos. That chaotic, out-of-sync feeling is what you experience as palpitations. While many things can cause a skipped beat, when it happens alongside other signs we're discussing, it's the sound of your body's drummer calling for help. Warning number 8, the head spinning signal. Have you ever stood up too quickly and felt dizzy or like the room was spinning? While this can happen to anyone, frequent episodes of dizziness, lightheadedness, or near fainting are a significant red flag. The problem occurs because a weakened heart can't respond quickly enough to changes in your body's needs. When you stand up, gravity pulls blood down to your legs, and your body needs to instantly increase heart rate and blood pressure to keep enough blood flowing to your brain. A healthy heart does this seamlessly, but a failing heart can't make that adjustment effectively. It's like trying to floor the gas pedal in a car with a struggling engine. It just can't respond with the necessary power. Therefore, for a few critical seconds, your brain is starved of oxygen, leading to that dizzy, lightheaded sensation. People often blame dehydration or medication, but if it happens consistently with exertion or changing positions, it's a serious sign that blood flow to your brain is being compromised. Warning number 7, the midnight intruder. Here's a symptom that often leaves people puzzled: suddenly needing to urinate much more frequently at night. This is a condition called nocturia. It's easy to blame an aging bladder or drinking water too close to bedtime, but this can be a surprisingly precise indicator of your heart's function. During the day, when you're mostly upright, a struggling heart allows fluid to pool in your legs. Your kidneys don't get a chance to process this excess fluid. Then, when you lie down to sleep, gravity is no longer a factor. All that fluid that was trapped in your lower body finally gets reabsorbed into your bloodstream. To grasp this, imagine you're a city manager trying to process recycling. During the day, all the collection trucks are stuck in traffic in the suburbs, your legs. They can't get to the central processing plant, your kidneys. But late at night, when the roads are clear, you're lying down, all those trucks suddenly arrive at the plant at once. The plant has to work overtime all night to process the massive backlog. That is why your kidneys are producing so much urine overnight. It's not a bladder problem. It's a daytime fluid traffic problem caused by your heart. Warning number 6, the sleepless prop-up. This sign, called orthopnea, creeps up so gradually that many people adapt without ever realizing it's a warning. It's the simple act of needing more and more pillows to sleep comfortably. When you lie flat, fluid in your body redistributes. If your heart is weak, it can't handle the increased volume of blood returning from the body, and it backs up in the vessels leading from your lungs. This pressure causes a tiny amount of fluid to leak into the lungs themselves. It's like trying to pour water into a funnel that's already full. The water has nowhere to go but to spill over the sides. In your lungs, this spillover is what makes it hard to breathe. However, when you prop yourself up with pillows, you put gravity back to work. It helps keep that excess fluid in the lower parts of your body away from your lungs, allowing you to breathe more easily. Therefore, if you've gone from sleeping on one pillow to needing a wedge or even sleeping in a recliner, you aren't just seeking comfort. You are instinctively medicating a serious circulatory problem with gravity. Warning number 5. The misleading gut feeling. Now we move to a set of symptoms that seem completely unrelated to the heart: persistent abdominal bloating, a poor appetite, or feeling full after just a few bites of food. This is one of the most overlooked areas because we recondition to think these are digestive issues, but they can be a direct consequence of heart failure. When your heart doesn't pump effectively, it doesn't just affect your lungs and limbs, it creates a backup in the entire system. This can cause fluid to accumulate in your abdomen, a condition called ascites, and also cause blood to congest your liver. Think of your liver as a sponge. Normally blood flows through it easily, but in heart failure, blood is being pushed back into the liver faster than it can flow out. Consequently, the liver becomes swollen and congested, like an oversaturated sponge. This enlarged liver pushes on your stomach and other organs, creating that feeling of fullness, bloating, and nausea. It's a gut feeling, yes, but it may be originating from a problem in your chest. Warning number 4, the cold reality. This next sign is a subtle change in your body's thermostat: persistently cold hands and feet, even when you're in a warm room. This goes along with a more clinical sign called a narrow pulse pressure. As we discussed with fatigue, when the heart is failing, the body intelligently redirects blood flow to the most critical organs. Your hands and feet are, from a survival standpoint, low priority. This reduced circulation is why they feel perpetually cold. The narrow pulse pressure is the difference between your top and bottom blood pressure numbers. Normally, it should be 40 points or more. A reading of 120/80 gives you a pulse pressure of 40. But if your reading is, say, 110/90, your pulse pressure is only 20. This narrowing suggests your heart isn't pushing out enough blood with each beat. Imagine a garden hose. The pulse pressure is like the force of the spray when you open the nozzle. A strong pump gives you a powerful, wide spray. A weak pump, however, results in a weak, narrow dribble. Therefore, a narrow pulse pressure is a measurable sign that the force of your heart's pump is diminishing. Warning number 3, the cough in the dark. A nagging, dry cough that only seems to show up when you lie down at night is another subtle but very important clue. People often blame allergies, a tickle in their throat, or post-nasal drip. However, a nighttime cough can be a direct result of that same fluid buildup in the lungs that causes orthopnea. When you lie flat, that slight amount of fluid irritates your airways, and your body's natural reflex is to try and cough it clear. Sometimes this cough might bring up a white or pink-tinged frothy mucus, which is a very clear sign of fluid in the lungs. Think of your lungs like 2 dry sponges. When you're standing, any excess moisture stays at the very bottom. But when you lay the sponges flat, that moisture spreads throughout, making the whole sponge damp and heavy. Your body senses this dampness in the lungs and triggers a cough, trying to wring out the sponges. As a result, if you have a cough that reliably disappears when you sit up and returns when you lie down, it's a strong indication that fluid, not allergies, is the culprit. Warning number 2, the terrifying awakening. We now arrive at one of the most frightening experiences a person can have: paroxysmal nocturnal dyspnea. This is what happened to Brenda in our story. It's waking up suddenly, 2 to 4 hours after falling asleep, gasping for breath with a feeling of panic and suffocation. This is a more severe form of the fluid shift that causes the night cough and the need for pillows. After you've been lying down for a few hours, enough fluid has accumulated in your lungs to trigger an acute, severe episode of shortness of breath. It jolts you from a deep sleep and often sends people scrambling for an open window, desperate for air. The key difference here is the severity and the suddenness. It's not a gradual discomfort, it's a terrifying event. People often mistake these episodes for panic attacks, nightmares, or severe sleep apnea, but the specific pattern, waking up hours after falling asleep and finding immediate relief by sitting or standing up, is a classic hallmark of advanced fluid congestion from a struggling heart. It is an absolute non-negotiable sign to seek immediate medical evaluation. Vital truth number 1, the shoelace signal. And now we come to the final, most specific and perhaps most surprising signal. It's a symptom you have likely never heard of, yet it is a remarkably accurate indicator of high pressures inside the heart. It's called bendopnea. Bendopnea is shortness of breath that occurs within 30 seconds of bending forward, like when you bend over to tie your shoes, put on your socks, or pick something up off the floor. Here is why this is such a critical and revealing sign. When you bend at the waist, you are physically compressing your abdomen. This increases the pressure inside your chest cavity, which in turn squeezes the heart. A healthy heart can easily handle this temporary increase in pressure. However, if your heart is already struggling with high internal pressures from heart failure, this simple act of bending forward is the straw that breaks the camel's back. To truly grasp this, let's use a final analogy. Imagine you have a water balloon that is already filled to its absolute limit. It is taut and strained. Now imagine gently squeezing that balloon. Even a little bit of external pressure will cause the water to squirt out the top because there is simply no more room. Your heart, when it's in a state of failure with high filling pressures, is like that overfilled balloon. The simple act of bending forward provides that gentle squeeze, which causes the pressure to back up into your lungs almost instantly, making you feel short of breath. Therefore, this symptom is incredibly specific. Healthy people don't get breathless from tying their shoes. If you do, it is a powerful, non-invasive sign that the pressures inside your heart are dangerously elevated. It is one of your body's most urgent wake-up calls. And there you have it. We've journeyed from the common deceptions like fatigue and breathlessness through the more puzzling clues like the midnight intruder and the misleading gut feeling, all the way to our vital truth, the shoelace signal. Recognizing these signs isn't about causing fear. It's about empowerment. Heart failure, especially when caught early, is a manageable condition. Brenda's story wasn't just about a diagnosis, it was about reclamation. By understanding what her body was trying to tell her, she was able to take action and reclaim her life, one precious moment at a time. Which of these insights resonated with you the most? Was it the idea of the sleepless prop-up, the cough in the dark, or was it our game-changing shoelace signal? Please, share your thoughts in the comments below. Your story might be the one that helps someone else recognize their own. If you found this journey valuable, please give this video a thumbs up. It truly helps our community grow. And don't forget to subscribe and click that notification bell so you don't miss our next video. Until next time, listen to your body, stay curious, and be well.